Hello, I'm Monica, and I'm going to be presenting Vignette 8, which is titled A Session with the Spouse. Before I get into the decision-making model, the ethical one, I kind of want to briefly describe the scenario just to give context to those who haven't read it. So essentially, it follows the clients, Mrs. Drapier and Mr. Drapier. The counselor is Dr. Faye Miller. So she starts seeing Mrs. Drapier, who's a 35-year-old woman, struggling with depression and some issues going on in her marriage. She reports that her husband has been drinking more, is depressed, and his symptoms are worsening despite him being in treatment under a psychologist who has advised him to stop taking his medication and to use an herbal remedy, which is St. John's wort, a supplement. So because of this, Dr. Faye Miller goes ahead and arranges a meeting for both Mr. Drapier and Mrs. Drapier to be involved in, just to see the marital dynamic and assess it. However, when Mr. Drapier arrives, she notices that he's showing signs of serious depression, increased alcohol use, and even smells it. So she gets really concerned, especially when he makes comments regarding suicidal ideation. However, before she's able to further explore what's going on, he abruptly leaves. So that takes us to the first step of the decision-making process, which is considering my insight, which is considering my beliefs, my values, principles, and worldview. In this situation, if I were Dr. Faye Miller, I'd be considering all these things because they can influence how I even interpret the situation, which we know can affect the outcome. So she would need to take some time to consider all of these, which could be views of just the marriage in general, her views of marriage, her views of depression, what she thinks is right or wrong. This could also include morals, which I think is really important. And there are a few dilemmas, which made this vignette a lot harder. So for one, there's multiple clients involved, right? So Dr. Faye was only seeing Mrs. Drapier, and then she later had Mr. Drapier involved, which has that issue going on. There's also the issue of potential malpractice because of the psychologist, Dr. Cooper, who suggested that Mr. Drapier stops his medication. He goes on a supplement. And then another issue that we see is the suicidal ideation, and especially the danger to the public. One detail that I did fail to include was the fact that Mr. Drapier and Ms. Drapier arrived to the session separately, which means if Dr. Faye smelled the alcohol or observed certain behaviors of being under the influence, it would suggest that Mr. Drapier was driving under the influence. And with that, the options there to either get involved with Mr. Drapier and take him on as a client, under specific guidelines though, which I'll talk about in a moment, or to refer Mr. Drapier out. But the overall ethical issue that I determined, which was the most salient and the most serious, which was how Dr. Miller would intervene with Mr. Drapier, given his suicidal ideation. So those are the two options. So we'll go ahead and see that. We'll go ahead and evaluate the ACA Code of Ethics. So there's a lot that goes into this, but we're just going to go ahead and stick to the main ethical issue, which is the concerning statements Mr. Drapier stated or reported. So the first ACA code we're going to have to go ahead and abide by is avoiding harm. So this can apply in several different ways. We can avoid harm by going through with the correct procedures when it comes to intervening with Mr. Drapier. This will also intersect with the reflection that I'll go through at the end. But avoiding harm can also apply to Mrs. Drapier, considering the multiple relationships to prevent her from being harmed, whether that's because of the helper's own beliefs and clouded judgment. But multiple clients is also another code. It's not exactly forbidden per se, but it's advised to forego having multiple clients just because judgment, like I said, can be clouded. There's different factors involved. It can be difficult to stay objective. And then abandonment and client neglect is also present. It's important that Dr. Miller doesn't just up and leaves either of them because of this situation. And it wouldn't be wise for her to completely disregard Mr. Drapier's comments. So I went ahead and looked up some literary references about this specific situation. The one I actually used was the textbook. There was a chapter that went over ethical dilemmas, and one was handling consent with clients. So in this case, it would be wise of Dr. Miller had a conversation with Mrs. Drapier about the multiple client situation. And then Mangano also discussed how to handle multiple clients and what that would entail, which is keeping objectivity and understanding one's limits. So it's important to keep all those things in mind, especially when we go into the consult with supervisor. So this would consist of discussing, the ethical dilemma and coming to a solution. Now, there can be several different ways this could pan out. Obviously, we don't know the exact extent, such as like what happened exactly right after the session, or even the client's reactions after the session. But I would consult with my supervisor, understand what the best course of action would be, following state guidelines, ethical guidelines, just to ensure, protocols are being followed and safety is ensured. But I did determine that Dr. Fay would have to have a conversation with Mrs. Drapier about the multiple relationship. And I thought it would be just to reach out to Mr. Drapier via phone, text, or email to maybe discuss a counseling relationship, not with her, but through a referral, and have an in-depth conversation with Ms. Drapier. Now, I would also inform the supervisor of my decision and report. That's super important. However, after this experience, it's really important that Dr. Miller reflects on this, understanding the importance of having an in-depth, informed consent conversation just to avoid things like this in the future. Also having urgency with at-risk clients and maybe having assessments to assess suicidal ideation and considering a safer route when she's unsure of unsafe ethical decisions.